Welcome to Warsaw. My name is Dr. Frank Henker-Stefani. I have been working as a scientist on nicotine and alternative products for many years. I'm here at the Global Forum on Nicotine, the best place in the world to talk about tobacco harm reduction and a very good place to meet the community and experts. I'm looking forward to interesting talks. Yes, it's a great pleasure to be joined by Professor Andrzej Fal, who is Professor of Medicine.
Well, good afternoon. Thank you for inviting.
Yes, we would like to talk with you about the health risk of traditional tobacco, and perhaps you have a summary or could give us an impression about the most relevant risks, and perhaps also to put it in context with the economic and society burden which is associated with smoking and traditional tobacco.
Well, the traditional cigarettes, it's for me a very bizarre thing because we already learned in early 70s of the last century that smoking cigarettes, it's very dangerous to our health. After that, we learned only worse and worse things. That now we know that cigarette smoking is the biggest killer in all the modern risk factors. It takes 8 million lives yearly around the globe. What more, it takes only 1 million of lives of those who never smoked, because we have secondhand smoking that's very unique. It's adaptable only to the classic cigarettes. So we've known this for 50 years over, and we still allow the cigarettes to grow. I mean, in 2015, the WHO published data showing that there is around 1.1 billion smokers around the world, which was a huge number, and the Empower has been announced before, and then a couple of other strategies fighting cigarettes have been announced, and now we are 10 years after it. And we have 1.3 billion smokers, which means that we are 200 million smokers ahead of the data in 2015. I know that in the meantime, the population of the globe rose by, let's say 1 billion, but still it doesn't mean, it does mean that the strategy employed so far by WHO and the member countries did not work. I mean, the success is not the word to describe what happened.
But if we have a quick look at the economic impact, there are several components to be regarded, not only premature death, but also loss of productivity, lost income due to disease. And is it possible to give a rough estimate how much really wealth is lost?
Well, all these estimates are really rough estimates, but still I started with the deaths because it's not only the biggest loss to humanity when so many people die, but many of them are in so-called productive age. So they're younger than 65, so they're still working, and their death means that they stop working, stop producing goods, stop building up the GNP, and so on and so forth. So this is part also of the economic cost. The second part of the indirect economic cost is that they become, people, smokers, they do become sick. They go to health leaves. They drop out of the work market earlier because they are not fit to work. Thirdly, and these are already not indirect but direct costs, they need treatment that need much more treatment than those who never smoked, because they have usually several chronic diseases, because almost all the diseases we know, the chronic diseases, the NCDs so-called, are at least partially cigarette smoking dependent. So when we look at the financial side of that, we estimate that around 2% of the global GDP is yearly lost because of smoking. 2% of the total global GDP is yearly lost. The American data suggests that the American industry in 2018, there's no newer data available, so in 2018 lost $600 billion because of smoking, including direct and indirect costs, but still it's a huge amount when we try to see how much the entire world industry would have lost in the same time, I'd say it's around $3 trillion loss in the entire world industry. So these are numbers that are unthought of, unbelievable almost. And when we tried to calculate the losses for the Polish economy only linked to the cigarette smoking, results of cigarette smoking, because, well, the economical effect of cigarette smoking is also excise tax and value-added tax. So these are positive effects for economy. But the negative effects, we can say that most is at around 100 billion zlotys yearly, which is an important number, even when compared to the entire budget of our National Health Fund, so the public payer of the health services in Poland.
Yes, you mentioned already that WHO policy is failing. I think we can summarize it with the slogan, quit or die, because WHO is not recognizing anything between. Would you agree with these rough analysis?
Yeah, this is a very rough but a very strict also analysis, because, well, WHO, as also many doctors, many scientists, and many social workers do not recognize anything in between. So when we stay in the world that is either black or white, so we say, okay, either you quit smoking and then we will help you, or go ahead, smoke, continue smoking and die. So either quit or die. And this attitude is, I call it a puristic attitude. So it's a black and white attitude. But, well, hopefully, and I think that in many societies, in many countries, especially European countries, another point of view starts prevailing. I mean, this is a pragmatic point of view, that there are people who, even though they try quitting, they even quit. So, and they return in a couple of months, so they quit again, and they return again. And there are some that are saying, okay, no, for me, you know, smoking or this way of behavior is so important that I'll not quit smoking whatsoever. Or I became sick already, so what's the sense for me, what's the idea for me to quit smoking when I'm already sick, when I have 2 or 3 tobacco-depending diseases? So, for these people, we need to have something, because otherwise we're just telling them we're not interested in this part of the society. And this is quite a huge part when we look at the countries, even in Europe, when we have 20% of people, or even 28% of people, the last report in Poland, smoking. So that's 28% of people. It's 1/4 of the adult society. So we need to reach hands to them, and not to tell them that they first have to fulfill some expectations, our expectations, and then we can help them. I know what I'm saying, because I was a smoker for 20 years myself.
I understand, but we recognize in Europe, also in Germany, perhaps in Poland, that many parts of the public are not informed. Many people do not know the different relative risk of alternative products, conventional cigarettes, and I think the problem is really that guidance would be expected by WHO and health agencies, which apparently is not sufficiently provided.
Well, the information should be provided much better and much wider, but what I insist on for many years already, without any result, to be true, is gathering all the available literature evidence, but gathered by an absolutely independent body of scientists, both from medicine, health sciences, economics, and so on and so forth, analyze where we have evidence, enough evidence, to prove that the harm reduction is really working in cigarette smoking, because we have no doubt about harm reduction in hard drugs or in sugar. But is it really working in cigarette smoking? And if they find, this group of people will find that, well, we have not enough evidence yet. So I think that from public money, there should be a prospective study checking out in 3, 4, 5 years the level of reducing harm by specific products. We have several groups of products, so I'm not telling of a specific one. And then after 5 years, what we'll say the interim time, we'll finally have the final proof. So evidence-based medicine, class A, saying, is it reduced or is it not reduced? And then we can base the entire taxing on a less harm, less tax basis.
Well, but many people think these assessments are delayed. E-cigarettes are in Europe now for more than 15 years. And of course, every agencies in Europe would have had plenty of options to start assessments, tumor potency modeling, looking for other evidence from oral products. If you would be asked by a patient about your estimate on risk reduction, do you think it's we have already sufficient evidence for a quite, let's say, educated guess?
Yes, for educated guess, there is sufficient evidence to say that most of the products we're talking about are less harmful to users than the regular cigarette. There are three conditions. First of all, and the first condition is that harm reduction should be applied only when harm exists. So the big mistake that we made in Poland and elsewhere too is introducing harm reduction products to the market without prior regulations, so that people who never smoked, so never did the essential harm with cigarettes to themselves, have access to the new products, and they became, well, kind of dependent on the new products. That was a huge mistake, but, well, we cannot go back. We need to live with that. So now I think that we have to focus on that these products will be or would be available in the future only to those who do harm to themselves by cigarette smoking. So restrictions as to whom sell, where to sell, how to do marketing, how to pack, should be the same to the regular cigarettes and to all the harm-reducing products. So they shouldn't be also the harm-reducing ones exposed to the youngsters, to not-smokers, and so on and so forth. That's my opinion.
Would you also apply that to tax issues?
No, that's what I said. If we see and we prove that there is a reduced harm, all the products should be taxed on the basis less harm, less tax. So that's pretty visible. And one thing that we spoke about this morning, your question was about the effectiveness of the excise tax. Well, it has to be adjusted to every market because another time in percentage and in real value will be successful in Germany, other in Great Britain, and other in Poland. So we need to adjust this data to the really market just to obtain a goal. If the goal is to reduce the cigarette sales by 20%, we need to observe the market and reach the goal while playing with the tax on different products.
It's only difficult to get a unified picture on markets because, of course, in Germany you have a higher income, but of course you have also benefits receiver who don't have much income. And so the question in the morning I was asking whether there should also be an upper limit for a price because it's quite difficult to have a price which is like as high as a bottle of champagne and to consider equality issues and to not really to give disadvantages to low-income people. So I think the matter is quite complex.
I wouldn't worry about the upper level of the excise tax because the market will react if it's too high. And you see that all the people, including at the middle class, middle class, will start looking for alternative products. Well, if these are harm-reducing products, okay, but if they start, looking for imports from Belarus or other countries, this will mean that you a little bit exaggerated with the taxes. So that's why I'm saying no matter what regulation we introduce to the market, we need to observe the effects of the regulation, not say, okay, well, we make this new regulation and we'll see what happens Who will see? The government will change. The ministry will have new men working on board. Nobody cares on the consequences of something introduced 5 years ago.
Yes, that's right. But I think it's quite interesting what you are suggesting. But to do so and to get into the track, you need firstly an honest discussion on relative risk. People need to understand that you cannot really equalize cigarettes, e-cigarettes, heated tobacco, and of course that would be the first step if the WHO would acknowledge that we have differences, that we have to investigate them, to assess them. But I think that will be quite difficult to force them to do so. Would you see any option, any chance that WHO would come to a realistic assessment of alternative products?
I started with that even physicians, even social workers and other health professionals, they not all of them understand what the harm reduction is about in the case of cigarettes. So I wouldn't expect a WHO being a very complex and slowly adapting institution to accept this point of view you're talking about before. There is a unified voice of the at least medical society. So I think that the third part I wanted to add for this basis for educated guess was education. Okay. Because education, we have no education. I mean both primordial prevention, so health education and then childhood and adolescence, but also education of the politicians who need to take, to make decisions about the excise tax. Not only, of course, they have hundreds decisions to make, but they have also many people working for them. So, but we need to educate them. We need to educate the newsmen and the media, because also they showing, sometimes very, very bad perspective of the comparison of the products we're talking about, including the comparison of the costs of smoking, non-smoking. So the numbers that I see in European news, not only Polish ones, are so different sometimes that people who read that and are not professionals in this field get really confused. So after all, by the end of the day, they don't know what to say because in the past 4 weeks they've read 4 different opinions. Yeah. Since they don't have their own one, so they don't know which one to follow.
Yes, but the problem is that international respected bodies like WHO should give guidance. And I think especially in regard to cancer risk, I think you could these days say very likely, very probably substantially reduced risk. And if there would be an agreement, I think we would be quite a step ahead. But what is your prognosis on tobacco harm reduction? Do you think it will move into the right direction, or do you rather see that it will slow down and maybe...
One more thing about the WHO, just to summarize this part. I think that WHO is losing at this side. I mean, we started saying that in the past 10 years, we have 200 million more smokers in the entire world. Of course, these smokers appeared and are living in different countries than 10 years ago. But this means only one thing, that WHO is puristic, not pragmatic. So they're not controlling the effect of introduced changes or suggestions or declarations. And there are many countries, especially in Europe or in the Northern America, who became pragmatic. So they're not looking to be purist, they're looking at the effect. And the effect, the desired effect, is to make people quit the regular cigarettes. Because we know that no matter how big the harm reduction of the new product is there or not, the cigarettes are the most harmful things. So being pragmatic for Sweden, Czech, Great Britain, some other countries too, means that we are not following the WHO we do have our own policy, our own public health policy, and following that, we have bigger success. In Sweden, yes, we are smoke-free country. In Czech, yes, we have a 10-year plan of getting smoke-free country. So these countries show that in the nearest future, in my opinion, more and more countries, more and more doctors, politicians, healthcare workers will look at the successful countries instead of looking at the WHO congresses, declarations that do not bring the real effect.
I think that's a very optimistic perspective. So reason will prevail, and perhaps if the WHO is not careful, it will lose authority.
Yeah, I do hope so. Actually, that reminds me of an old joke. What's the difference between an optimist and a pessimist?
Yes.
So you know that the pessimist is a well-informed optimist.
Okay.
Okay, but I remain an optimist in this case, at least.
Then I would like to thank you very much for the interview and your presentation
Thank you.
in the morning. It was a pleasure talking to you, and I hope you are still at the conference. So maybe we can continue, have other talks with you and the community over the next days. And I think it's a very great and enjoyable event. And we are quite really happy to be here in Warsaw and be guests at the conference.
Thank you very much. It's really good to have you here in Warsaw, and I hope that a conference like this one will push the story a little bit forward to the right direction, of course. Thank you.
Thank you very much.